Hi, folks. Thanks for coming today, and thanks for everyone on the Hangout. I think we're probably expecting the crowd to fill in a little bit more as we go. I'm really excited to welcome Merrick Schaefer here today. Merrick Schaefer is the lead for mobile development at the United States Agency for International Development. He and I used to work together at UNICEF Innovation on Mobile for the Global South, particularly around education, health, and other sort of outcomes around human development. He's here to talk to us a little bit today about best practices in using mobile and other forms of ICT or information communication technology, text messages, simple handhelds, and the like in Global South environments. Thanks so much, Merrick.
Hello. All right, let me get the distance right here. As Catherine said, I work for USAID, which is the US's lead government agency for international development. We focus on, our mission actually is to end extreme poverty, so we don't set the bar low with what we're actually trying to do on a day-to-day basis. And we've got a big focus on kind of generating democratic processes in society as well. And who am I? So I was a software dev for about 10 years in the private sector. I did everything from work at Accenture to help small NGOs get their websites up. And then I ended up at UNICEF as a dev in 2006. And within, I would say, probably about 9 months of being there, a group of us that were always trying to push the boundaries of like what we could do with technology kind of got corralled by a pretty senior leader in the UN. And asked to try to apply the technological approaches that we had at our fingertips to the development problems that UNICEF itself was trying to move forward. So how do we improve quality of water for rural children in Indonesia? How do we improve the educational quality of teachers in Burundi? And so we failed nonstop for 3 years and tried everything. And one of our earliest projects actually was using MediaWiki back then to see if we could create offline content that would run on the OLPC, if any of you here remember that from the MIT Media Lab, as a proxy for local curriculum in the education space, and it never really quite worked. But it was a really fun experience, and we did a lot of usability work on the ability to edit Wikipedia pages, and some of that I think got rolled back into the core, which is pretty awesome. And then what we did find, and most of this presentation is about, is how to use really basic mobile phones. And once we started doing that, our project started working, and they got really big. And then I left UNICEF and went to the World Bank, and again worked with Catherine there, on national level systems. So systems that the government had for health workers, for education, and I'll walk through what those look like in a second. And now I'm at USAID, where I'm working on essentially the upstream barriers to having all of the programs that we design and implement use technology and innovation better in their work. So when we think of international development, these are really the people that are the customer. These are the people that we're working for, that we're working with. And understanding the context of their lives and what matters to them and how they get around on a day-to-day basis, what their stresses are, is really critically important. Most of the work that I've done, and a lot of the work that I'm talking about today, is focused on Africa. And you might say, well, why Africa? And the answer to that is essentially like the problems in rural Africa are the highest amount of constraint from a solution creation perspective. And we all know that constraint is what drives good design. So if you can pick the most constrained environment to get something to work in, you probably get it to work other places as well. So we spend a lot of time not in Nairobi or not in Kampala or not in Lagos, but in literally the middle of nowhere, working with communities, trying to get our systems and tools to work. There's not a lot of infrastructure in rural Africa. In fact, only 29% of roads are paved, meaning that 70% are not. 40% of people don't have access to safe water, so there's a lot of diarrhea, which kills a lot of kids. 75% of people don't have access to household power. So what are we doing messing around with technology? Well, there are more mobile phone subscriptions than there are people on the planet. That's because people have multiple phones. Some of you people here probably have multiple phones. There's more mobile phones than there are toothbrushes. There are more mobile phones than there are toilets. If you went to Africa in 1998, you would have found a very small, very rich segment of the population who had phones. So Africa's 54 countries and 1 billion people, and there were about 2 million phones on total on the continent in '98. By 2011, there were 650 million phones, and it was an exponential growth curve, and this has just continued. There are phones literally everywhere. And The Economist itself stated that the adoption of the mobile phone has been the fastest adoption of any technology ever since humanity has come into consciousness. If you look at the population density, Catherine's laughing because she's seen these slides before many years ago, some of them. So if you look at the population density of Africa, it roughly looks like this. And if you look at electricity, right, so let's go back and forth here. So there's population, there's electricity. Not very good. Fixed line electricity is not that great. But if instead you look at GSM coverage, which is the access to mobile networks, it covers everywhere that people are. So what does that mean as a technologist? It means that there's a platform. We have basic mobile phones. We have a poor network, but it exists. And people find ways to charge those phones. They just don't own a phone because it's a vanity thing. They own a phone because they use it. And an interesting thing about phones is they don't compete with other modes of communication. They compete with transport. So if you think of a mother in a village who doesn't have a modes of transport and she needs to go to the market to purchase something, she could walk 8K or maybe pay a lot of money to get on the back of a motorbike and ride to that market. It's an expensive both from a time and a financial perspective. But if she can just call, right, that costs her something, but it costs her a lot less than the time and money it takes to get to the market to see if that product's there. So that's what I mean by it competes with transportation. And that's one of the reasons why mobile phones spread. The other one was, and this is really interesting, the innovation wasn't the mobile phone. It's not the technology. It's not the hardware. What was the innovation was the ability to pay for teeny bits of voice service or SMS service. So people in Africa don't have monthly subscription plans. There is literally a person everywhere. It's hard to find a place where there's not someone who's selling scratch cards, and you scratch off the back of the card, there's a code, and you put that in, and it might buy you 1 minute of talk time, and you'll make 10 calls for that 1 minute of talk time. That was the innovation that spread, and that particular financial innovation is spreading into all sorts of other areas, and it's really fascinating. Into energy, buy as you go, into water, buy as you go, buy little bits, and it's really relevant. But of course, there's a tremendous amount of constraints because we're talking about Nokia candy bar phones. We're talking about the 1100. And how many people here have texted with a T9 interface? Just when you have the numbers and you get like, yeah, right? That is not a good UI. It's a horrible UI. And then from a design perspective, what do you do with that UI? Costs are high. SMS message, I used to know this off the top of my head, but I've long since forgotten it, is really expensive compared to a data plan for how much data you can actually transfer in that 140 characters. And there's incredible limited technical capacity. And this isn't just like there's no IT groups. It's like people might own a phone, and they might know 2 patterns to push their fingers, which their son and daughter will answer. And they don't know about the address book. They don't know how to SMS. They don't know what happens when things flash up on the screen. They just kind of like hit buttons until those things go away, and they use the phone for one singular purpose. So there's not much technical capacity. However, this is very similar, for those of you who are devs here, to the command line. So the way we started thinking about it was, hey, you know what? SMS is kind of like a command line without the ability to have a man page, right? Like you can't like ask it, well, what can I actually do with this command line? But also, if you send something over that basic command line, it doesn't have to be a person on the other side answering that. It can be a computer. And with the advent and explosion of cloud computing, or at least local servers in place, you actually had a pretty powerful platform. You could enter a command through SMS, and the computer could do something with it and return some sort of value. But actually, you can do a lot with basic phones. There's been a tremendous amount of innovation, and really psyched on this, on call centers, having an actual person on the other side. People have phones, they know how to make phone calls, and sometimes it's the fastest and best way to get the right information to the right people. But there's also IVR. In some markets, IVR just does not work. People just refuse to press 1 for. But in other markets, it works really well. And like in Ghana, there's a service that's both SMS and IVR, and 90% of the people use the IVR service. They do not use the SMS. Also gets you around literacy problems. But there's also a lot of innovation around decision trees with SMS. So just really simple if-then logic that drives you down a path through SMS. And a lot of the work that we focused on was syntax-based SMS. So we're actually sending a command like a command line, right to a server to do something with it. And the last format that you can do with basic phones is USSD. How many people here know what USSD is? All right, so there actually are a bunch of people. It's a session-based protocol, so it opens up, it knows who you are, that you can interact with it back and forth a few times. People top up their phones with USSD. That's how they add credit. That's how they add those teeny bits, those minutes or 5 minutes worth of talk time to their phones with USSD. So almost everyone knows how to use it. However, from a UI perspective, it's 10,000 times worse than SMS. It is so bad. Anyone who's ever done anything with USSD will understand the sessions drop all the time, then you have to restart. They rarely connect. You have to like press buttons 3 times to get people to say, go to the next menu. It's really, really horrible. But there's been a lot of interesting innovations with it. And of course, once that data comes through the phone, then we're back in a realm that I think most people in this room are familiar with, of like, how do you make sense of data? How do you make it useful for people? And you can do a lot with the web side of the data that comes in through the basic phones. So we use these across all sectors. So USAID is organized around big, what we call developmental sectors. So agriculture, water, education, humanitarian response, and health. And I'm going to talk a bit about health today. So the first story I'm going to tell is to give a sense of how can you use basic SMS on a basic phone to actually create impact. Like, how does this actually make a woman and a child's life better at the end of the day? And so this is a project that we did really early on reducing malnutrition in rural Malawi. And I did this while I was at UNICEF, or I helped with this. There were a whole bunch of people that worked on this. So Malawi, for those of you who don't know, is a small country in southeastern Africa. It's got about 14 million people, and it's really densely packed. It's mountainous, it's lush, it's beautiful. It's a beautiful country, and the people are very engaging and very chill. It's like a very like relaxed place. However, there's a large problem with malnutrition, and the interesting thing about malnutrition is it can be measured extremely accurately with 4 variables: age, height, weight, and upper arm circumference. With these, if you can get these 4 numbers, you can tell not just if a child's very malnourished, and if they are, if a child's very malnourished, you've seen the photos. They have a distended belly, sunken eyes, they look sick. But a mildly malnourished child, which has long-term developmental disabilities related with it, like lifetime stunting, educational difficulties, is invisible to the naked eye. So a lot of kids that are not actually getting the right sort of nutrition in their diets, you can't tell that they're going to have these problems later in life. So you need these 4 variables. It's called MUAC, which is why I wrote MUAC there. This is the context of where we were working. This was a health center that we were visiting. People would walk to this health center mostly. Sometimes they would spend a little money if they really needed to ride on the back of a motorbike, or they would have a bicycle if they're a male. Women generally weren't allowed to ride bicycles. This is the inside. Oh, you can see there's fixed line power here to this particular clinic. However, it probably goes out all the time. Brownout, constant rolling brownouts. It's not a reliable power source, but there is a power source. You can recharge things while you have it. Inside, there's no running water, but it's very organized, very orderly, and a lot of basic supplies to be able to handle a lot of basic problems. The demand is extremely high. So every morning at 7 a.m., when you open the door to the clinic, this is what you see, and this line just goes and goes and goes and goes. And these women have walked with their children who are, if you think about it, what are they doing at the clinic, or what would they be doing if they were not at the clinic? They would be tilling their fields, or they would be working with their 6.7 other children, if you look at the average birth rate. So they're taking one of their children, leaving their other children with someone else in the community, and walking 2K, 5K, 12K to this clinic. So by the time they make that decision, their child is generally pretty sick. So the other really stressful thing about this particular line is there's a lot of crying babies, and it's just a really chaotic environment to be operating in. So we were sent there to improve the Ministry of Health's ability to gather data on malnutrition, because the Ministry of Health of Malawi wanted to improve its programs. So they were like, help us get better data, help us collect those 4 indicators. And so we went there and we looked at the system, and community health workers, which in Malawi are paid people, but not paid much. They're sort of pseudo-volunteers. It's sort of like if Wikipedia editors got a little bit of money to contribute. In a lot of countries, they're not paid at all. Would take these measurements and they would write them down, and on days, there'd be certain days of the week that would be malnutrition days. So the mothers would know that, they would bring their children and they would measure them, And then they would send it, and it says postal system, and I really should change this because it gives the wrong impression. So you would have some people take these pieces of paper, and maybe a different person every time would walk it to the district health center, leave it there, some random point in time, someone would pick it up on the back of a motorbike and take it to the provincial center, and then maybe there'd be a courier service to pick it up from there, and eventually would get somewhere. So being a bunch of software developers, we were kind of like, okay, so you get the data is hard to get, but like we cannot wait to see your database schemas. Like we want to understand how are you using this and what's going on with all this data, and this is what we saw. So this is their database schema. This is their data. And as you can imagine, it's not used, right? It's not used at all. It's not used for planning. It's not used for anything unless there is donor money that requires reporting to get the next tranche of money. So financial incentives work really great. People might dig through this and put out numbers back for organizations like my own, so we would release the next round of funding. So not very useful. So we started with this, and we did one thing. We dropped this phone in here. And all of a sudden, we had a system that allowed that community health worker to send in, rather than write down, just text in those 4 variables in a single SMS message. And you all of a sudden, in real time, had analyzed information, so not locked up on paper, but actually like charts and graphs and diagnoses, and you had it on a map, and you could see where was malnutrition a problem, where wasn't it a problem. And you also got this data to be shareable amongst other partners for the government. You could, for the whole country, you could compare it regionally, compare it globally. So all of a sudden, this data went from completely useless to pretty useful. But the biggest insight was one of empathy. And so these community health workers work a lot of hours, and they also have children, and they also have other work, and they're earning a little bit of money being a volunteer basically in their society, and they're never thanked for what they do, especially by people who collect data from them. And so one of our developers suggested, why don't we send a thank you message back? And we said, great. And people flipped out. They had never been thanked. For them, data collection was a one-way process. It went somewhere. There was never any feedback loop. They weren't thanked for doing it. It was a job requirement. And all of a sudden, they were thanked. And then we said, wait a second. We're sending messages back, and we're crunching the data, and we're doing the analysis, and we know which kids have mild malnutrition. Why the heck aren't we sending the diagnosis back? And so we kind of went to the ministry and was like, can't we just send the diagnosis back? And they were kind of like, what? Okay. Like, it was like, what are you talking about? And the community health workers have like a chart. And if you take those, if you run your finger on the chart, you can see whether or not that child, what percentage they are in malnourishment. They do not use that chart. They do not. Like, I've never seen one use that chart. They would do things like feel the child's hair, which is not a valid method of determining mild malnutrition, right? So like they had like sort of like ways that they would kind of give advice to moms. And all of a sudden they had a diagnosis coming from an authoritative source which empowered them in their role as a community volunteer helping the mothers in their community. And they really liked it. So we created this feedback loop. So we went from a one-way data collection system to improve ministerial planning for how you design malnutrition programs to a treatment tool that actually helped the livelihoods and the lifespans and the educational capabilities of the children in Malawi. This program now is at national scale in Malawi. It got merged with a few other programs we're working on and has been trained, and it's now the whole country is using this. Couple interesting things about this program. It's sustainable. What do we mean by that? Well, people use their own personal phones, and they keep them charged, and they know how to use them. And so if therefore no donor or no government, no taxpayer base has to like pay for a lot of Nokia phones. You might think an individual Nokia phone is cheap, but there's a lot of community health workers. There's a lot of facilities. And then what's the IT network to keep those phones up? And who's responsible for charging them? And who pays for the charging of them? Who pays for the top up time? So people using their own phones. So we also set it up in a way that as long as you SMS this number, you can see the syntax here actually. For those of you who are developers, this is like here's how you do it. We made it so it was free if you SMSed anything to this particular number of people. So there's no price sensitivity. So the total cost to us who were implementing this program was the training, which took about a half a day. And it took years to train everyone in the country on it. But it wasn't very expensive. And then the cost of the SMS messages and the server upkeep. So it was like a very, very cheap program to run at a national level to improve malnutrition. But also, there's data, and real data, not data just in stacks of paper on the ground, but data that says something that's relevant to the lives of the health workers. And you can take this data back to the clinics, and you can say, look, your malnutrition rates are really going up. what's going on? And well, maybe like it's a bad part of the harvest season and there's nothing other than mangoes to eat at that point in time, and it's really hard to keep children nourished. So that then changes, how do you have strategies? How do you develop strategies to address not malnutrition, but those 2 months where there just isn't nutritious food? And what kind of strategies can you put in place to address that? It gives you a level of targeting we could never have before. So if that's sort of the type of impact you can have with these simple technologies, how do you actually make something that works, right? Like, how many people here like make things, like write code, create stuff, like, right? So it's hard. It's hard to make things that work well, right? It's easy to make something that kind of works. It's really easy to make something that kind of works. You can like show someone like, check this out, and people are like, that's cool, you know. But if you actually want to take that thing to market, like, it's really hard. So how do you do it when you don't speak the local language? You don't understand the people themselves and their livelihoods, what matters to them. And so this is a very different project. It's in both health and agriculture. And we did it this way because we wanted to make a platform. We didn't want to make a product. And we knew that we wanted it to work in multiple sectors. And so we picked 2 very different sectors, agriculture and health. And we tried to make the same tool work in both, knowing that if we got it in these 2 disparate sectors, we probably also could apply it to education, to wash, to other areas, or water and sanitation. So this was in Nigeria. And for those of you who, well, probably everyone here has heard of Nigeria. It's the largest, most hustling, bustling country in all of Africa. About 180 million people on paper, and probably like 250 million people in reality. Tons of immigrants flow into Nigeria. It is like an economic just hub. And up until the Saudis changed their oil policy, they were very wealthy with oil money. They have a lot of money. They didn't take much donor money, or the amount of donor money they took might be large because they have a lot of people, but it didn't matter because the amount of money that they had. On the flip side, extremely unequal. So like, while there is a jet set class, and I mean jet set, I mean like Larry Sergey jet set type class of people with stolen oil money and profits, like, there's also the majority of people who live in the country and they live on $1.25 a day. So really unequal society. And in these 2 areas, you know, people have phones, but they don't have empowerment. They don't have any say in government service delivery. Like, the idea of, I'll get to that one in a second. The idea of using your phone to report on the fact that there was no one at the clinic when you showed up at 9 a.m. and they were supposed to be up there at 8 a.m. and then no one showed up till noon, like, that's not an understood modality. There's no complaint box if you're a poor mother that earns $1.25 a day. Like, you're just thankful that someone's at the clinic. And we had basic phones, but we had really bad reception. And what's going on here is, this is the tree in the village where there was reception. So this is where people walked, where there was reception. What they did was they would go to this spot and they would type an SMS message. And then this is a plastic bag that they had nailed to the tree, tied a knot in it. And they would slot their phone in this plastic bag and they'd walk off and they'd go do something for a while. And they'd come back 20 minutes, 30 minutes later, and then they got their SMS back and they would take their phone and great, and off they went for the day. And like, there was like, this tree had a whole ton of these like little plastic bags on it, and this is just how people engaged with SMS. So like, a lot of the conceptions about what do people do with phones, how do they engage with information, like, whoa, throw those out, because it's not how people engage. And also, going back to that point about empowerment and like trying to get feedback on government service delivery, in order to do that, we had to understand a lot more than just how to build technology. We had to understand, how do people perceive justice? And we learned a lot of interesting things about how there were 2 justice systems. There was a tribal one, and there was a legal one. And what things fell in what category were just bizarre. It was really crazy, like, what things were brought to local tribal justice systems versus legal ones. And when you're thinking about complaining to government, which government? What sorts of things qualify for complaint? Hierarchy, entitlements, money, leaders, of course, the agricultural system itself. We had to understand all of these things in order to make a simple suggestion box type system. So we started with the people. We went to where they lived. We spent weeks in the field, not in Abuja, not in Lagos, but out in Nasarawa State, in the rural areas. And with the sort of techniques we did is we do focus groups. So we'd have a fixer, which is a term from journalism to help journalists get around and get the stories they need. So they're people who kind of know how to make connections, know how to introduce you. And we would zip into like a little village, we'd be dropped off, and people would kind of, what's going on here? And we explained who we were, and people kind of be curious, they'd come forward, and we start engaging them in semi-structured group interviews. We do one-on-one interviews, and you'd have to do repeated ones with people. You have to build trust and try to get a sense of like, what are their actual day-to-day lives like. So here's a nurse explaining to Beth about women coming into the clinic. And we did a lot of shadowing. And that means following people through their day-to-day life. So in this case, we actually got permission from a mother to experience what it was like to do an antenatal care visit. So we like sat with her outside in the sun until a bench opened up inside, and then we sat with her inside, and we went through the whole process of what it was like to be experience what a nurse midwife does with a mother. Now, of course, there's the Hawthorne effect, which probably many of you here know, which means that we were definitely like changing the dynamic of the situation. She was definitely getting a lot more attention and service than she would be probably otherwise. But nonetheless, it gave us a sense. What is the context of that woman's life and that engagement with the health center? We also had to explore local leaders, and local leaders were extremely important, both formal and informal. So again, there are those two systems. There was the local tribal systems, and there were business people, and there were politicians. We explored processes ad nauseum to the point of insanity. And what I mean by this is, if you ask someone, what's the process? How do you do something? They'll take you through it really fast, and like they'll show you, they'll rush and they'll find the registry, and we write it down here, and then we do this, and we go up here, and we do this, and you're like, great, awesome. And then if you hang out for a couple days, they start getting antsy, and then they stop doing that, and they go back to how they actually do things. And what we found was that there were a tremendous amount of ad hoc processes, and they were trained in a certain way, and they knew they were supposed to tell at this time there was a World Bank project, so they were supposed to tell the World Bank people how they officially did things, but it wasn't how they did things. They did things in the way that actually worked in their day-to-day lives. So we would hang out long enough to actually get to a sense of how do people actually deal with people coming in. And we went to local businesses, and this is another interesting anecdote. So health facilities all over the place. Nigeria's got a lot of money, not a lot of capacity, so they built out a lot of health facilities. These health facilities were empty and staffed with all these people that knew nothing about health, but like they were staffed fully with lots of people, 40 people sometimes, and they'd have 2 patients. However, these little pharmacies were packed with people. People would be lining up out the door. And what we found was, we explored, why do people go to pharmacies instead of health centers for health services? 2 things. One, they had drugs. That was the health facilities didn't have drugs. Number 2, they extended credit. The health facilities would not loan you money to purchase the drugs you needed on the spot. Now, if you look at the poor, you often are in and out of poverty. You're like kind of like you're on this sort of like bouncy curve. And so sometimes you might have money to pay for the drugs, and sometimes you might not, but you'll have money next week. And these guys, being smart businessmen, knowing nothing about health, like knew that, and they would like cut deals locally to people. So we were like, whoa, this is really interesting. How do we actually engage the formal health system? People are using the informal health system. The other scary thing is this guy has 0 health training. He does know how to source drugs, often buying the drugs that are supposed to be going off the black market that are supposed to go to the health facility, which is why the health facility has no drugs. But that's a different presentation and a different story. But he doesn't know anything about the right sort of advice from WHO on what a pregnant mother should be doing. Yet he is the point of contact and the point of advice. So what do we do with all this? So we would do this sort of like really rich qualitative research. And every night we would spend 2 to 4 hours doing what we call synthesis. And so we would take all those observations that we had from the day, we'd read out our notes, and like we would write down what we thought were interesting observations. We sometimes would generate insights out of that. We would then shift from that to hypotheses that we would test against the evidence that we had on hand. We would take those processes that we had people describe and turn those into systems maps. And then it would come out something like this, and this is what we'd be sharing with government and with the other folks. But we also created user profiles. And so this was the young mother. So we would create these amalgamations of characters that we interviewed. And this was so that when we were designing services and products, this was one of the actors in the system. And we had like where she was in the system. We had how empowered was she? You know, how much does she use the service? How educated is she? Can she read? And so we would have this sort of profile, and we would always we'd often give them names, like we didn't do it in the formal documentation, but we'd be like Jane. And so then we'd be like, wait, how would Jane use this? How does this fit into Jane's life, right? We'd actually create these personas, and those were the characters by which we would design our user interactions around. And for those of you who do software, this might seem like a no-brainer, but in international development, we do waterfall planning. We design 5-year, $150 million programs that we then see if they work 5 years later. So we like spend all of this time, we spend years planning, we design the system, we put it into play, and then we do an evaluation when it ends at 5 years. By the time the evaluation gets written up, the next program's already been designed and already been funded. So we are really bad at learning. So we were doing rapid iteration of software development, the exact opposite. lessons about software development in this context. Hire local developers. Now, for this particular audience, this probably makes a lot of sense, like build community. So this is Inchimunya and Quasi, and they are awesome. And they did not know Python, they did not know Django, but they sure learned it fast when we brought them onto the team. And we empowered them with the decisions from day one to help us make with a few Western developers that really did know. They were great developers, they knew what they were doing. And by the time the project ended, these two guys were able to carry on the work. They got hired on and are still working to this day running these systems. Without them, it would have broken and been shut down years ago. Go to where the problems are. So for software development. So we actually, this is us 12 hours on bumpy roads from the capital in the middle of nowhere. There's no internet here. We had to set up a local intranet that we ran our own Git server off of so that we could do our development work. It is a harsh environment with power going off and on all the time, but what it gave us was the ability to design things in a participatory way, where we actually could do agile development in the same way that when I worked for Accenture, we would go move into the bank's office and we'd be working back and forth with people that were going to use the software on a day-to-day basis constantly. We were doing this with the very people in the clinics who are using the software. And they don't know what software is, and they don't understand what we're doing. But over time, you go there and say, hey, you want to try this? This is what we're thinking about. This is what we're talking about. And they can't do it, and then you come back. And we learned so much, and so many of our assumptions were just completely wrong. But by the end, we had a product that worked and solved the problems that they had locally. And this is key for adoption. If you want your stuff to work, it's got to solve the people's problems locally. Otherwise, you're going to be told to do it, and then they're not going to use it. So this may or may not be relevant for this audience, but that bunch of these projects were built on this open source framework, which we developed for this express purpose of rapidly building text-based mobile applications. It's now kind of being phased out. It's still used a ton of places. I was in Ghana a few weeks back and found their supply logistics chain for medical commodities in the country was using this under the hood. I was really excited to find that because I was the community manager for quite a while on this project. But this is the kind of stuff that we built in order to be able to do this work. Then rapid prototyping. So this is me. I'm talking to a farmer. He was a yam man, and he made me an honorary yam man, and it was all about yams, and I learned a lot about yam farming. It's really complicated, really interesting. But here he was trying to complain about the fact that the fertilizer that he was getting through the subsidized, discounted farmer cooperative came after the planting season. Not very useful, right? So he has to make a day-to-day decision. Do I go buy more expensive fertilizer and make it in time for the rains, or do I wait for the subsidized one? This is a big problem. This is like a feed your family level problem for him, right? And he had no previous way. He just had to make a call at some point. Okay, I give up. I'm going to go, right? All of a sudden, he has a voice. And more rapid prototyping, just endless cycles of this. And so here, that would feed into synthesis. So this was the end decision tree diagram. And what did people care about when they wanted to complain? Well, the categories that were relevant to them wasn't how we designed the program. It was information, people, and money. So what do you have a problem with? I have a problem with money. And then we'd have chains down. And this allowed us to get that information semi-structured so we could direct it to the right people to work on it. More prototyping. And at the end of the day, we had an SMS system that actually worked pretty well, resonated with people. They understand what on earth we were actually asking them about, and the language we used resonated with them, and they believed in it. But of course, the technology wasn't the only part of this. How do people know about this? How do we create a sense of empowerment and identity? So we did visual design testing, followed the same methodology. Started with paper, moved to higher tech prototypes. And then ended up with a very garish, but fit in perfectly with the ad environment that people were in, the same thing, that the same types of colors and energy that the telecom advertisements had, that the Coca-Cola advertisements had. And also this bullhorn was what was still in constant use by town criers, which was a major way that people got information. A dude would walk through with a bullhorn, not a powered bullhorn, but like a leather bullhorn, and he would shout out things that were important. And so then people saw this, they're like, oh, I'm going to be shouting out what's important about my life. Now, what's the point of having a complaint system if the people you're complaining to don't respond, right? You will put all of that work, all of the energy into making a useful system, and then people will lose trust with it within how many times? How many times would you complain if you got no response back, if no one answered the phone, right? You wouldn't complain very many times. So we knew that the crux of this problem was getting government engagement, and this is not an easy thing to do. So we took exactly the same approach. And we went, we sat, and we worked with the local government officials. We understood what their problems were. And they're not, maybe people are taking money on the side, but that's not why they're doing the job, right? Like, they are doing the job because that's their role in society. That's what they're doing, and they want to do a better job. And so we had to convince them the system wasn't an accountability system. We were going to try to catch them doing something wrong. This was an empowerment system, and that was so much harder than working with the farmers or working with the young mothers. So one of the outputs of this process was, this was a World Bank process, so we created guidelines and policy and regulation and blah, 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 blah. But we also created a dashboard of information that they themselves, the local government officials, thought was important, that they themselves could explain what they would do with it and why they would do something with it. And so in this respect, we were meeting with the very important head of health of Adawama district, and he had on his ceremonial robe and his hat, and he was very formal and very nice and very welcoming. And he would direct his people to sit and push buttons on the computer, and he would over their shoulder tell them things he needed fixed on it. He would tell it to them, and we'd hear him saying it. And then at the end of the session, he thanked us for coming, and he said, "Okay, I will see you in 6 months." And we said, "No, you're gonna see us tomorrow." And he was like, "What?" World Bank people don't come the next day again. And we showed up the next day. Everything he had said had been done. A lot of the ideas he suggested were horrible ideas. They were like UI nightmares. They made no sense. But everything that he had suggested, we did. And all of a sudden, his eyes opened, and he was like, "Oh, wait a second. This isn't some sort of formal exercise." And he got a lot less formal. He himself, at some point, got down and started hitting the buttons himself. He got engaged in the process, and we actually started a working relationship, and we built something that he wanted and was used, and then he got all of his people excited about it, and they actually started using it. So all of this goes to say that these two systems are demonstrations of how the technology that people had in their hands can fundamentally change this particular arrangement. So like this nurse who's at an outpatient clinic. So what this is a 3-walled with a tin roof hut that's far, far, far from the health clinic, but within walking distance of a lot of places where people live, that she drives once a week to give vaccinations, to do those malnutrition measurements, and mothers go there. So all of a sudden, she's empowered with a whole new set of tools that make her life easier, that empower her to do her job better, and actually save the lives sometimes, and definitely improve the lives of the people that show up. And these women over here, for the first time ever, have a voice in the processes that affect them. This guy here, I love this guy. He had this limp, and he had this air of authority, and he just was like, he would hold court, and he was the district level manager. And he had this thing. I don't know what it is. I think it's a fax machine. It certainly didn't work, but he was very proud of it. And he had a laptop, but he kept it at home. But he did have one because he'd bring it sometimes, and that's the stuff we'd work on it with him. But if you see, this is his information environment. This is how he engages with the world around him. And he all of a sudden, he's empowered with real-time information about what's happening in his district and what's going on and who's doing what and what people are saying about it. And then you have this guy here who actually has data for the first time ever, real data, that's given back to him. It's not just being collected one way, and is actually empowered to use that data and to try to create trend lines to say, can we reduce the malnutrition problem in my community? Right? That's what he's there to do. And now for the first time, he can see whether or not he's doing something that matters. And so the kind of meta point of all of this is that the skills that you all have in this room and the tools that are in play right now can cause incredible social change. And I feel really weird saying this to this particular crowd, saying that like you guys do this day in, day out. But you know this to your core. You understand the power that these technologies have and the transformations they can actually cause. But the very skills and the processes and approaches that can make Larry and Sergey billions and billions of dollars can be applied to real social problems in real ways if you dig in. So the difference is, while I love hackathons and I still go to them and I still spawn them, what you can do in a weekend can't ever get you to the level of context to ship a product. No startup ever like had a hackathon and then launched and then like was successful, right? You need to understand your market segmentation. You need to understand the nuance and the needs of the users. You need to understand it better than they understand it. And then you can create something that works and gets adopted and grows virally on its own. So like there's a tremendous amount of potential and it requires a tremendous amount of engagement. And with that, thank you, and I'm happy to open up for questions.
Thank you so much, Merrick. I think the idea is we have about, 20, 15 minutes left for Q&A. Questions about everything from agile development in low bandwidth environments to user research to market segmentation, as Merrick mentioned, to maybe just personal experiences doing this. And of course, this is all about health and development, but I think that the corollaries between health development and information, we can really start to dig in or ask questions or even have conversations ourselves about that. So I'll hand it back to you.
Awesome. Questions?
First, thank you. It's an absolutely wonderful presentation. As we start looking more seriously at the Global South, the example you just demonstrated is very useful for our own practices. My question to you is, what kind of budget was involved in doing the programs that you told us about?
Yeah. So I'll answer that in two ways. I'll tell you what we spent the first time around, and then I'll talk a little about what the stuff actually costs, right? So the first time around, we were bootstrapping. We weren't sleeping. We were leveraging UNICEF's brand. We had UNICEF, which you guys have a great brand too. We were leveraging the heck out of that brand to get free contributions. We were building our own stuff. We were just like, we threw ourselves at it. To build that first type of system, we could roll something like that for $300,000 to $500,000. At scale, scaling it was a completely different story, right? So like that was what it cost to like kind of build it, right? A system like that at scale to maintain over the course of a year with 14 million people roughly is going to run you $150,000 to $200,000 in overhead costs. That includes salaries of people in the ministries to run the system and the servers, the bandwidth, and so forth and so on. Those numbers are somewhat variable, and it depends a lot on the size of the system. The actual costs, so when you shift from getting free pro bono donations of help to actually paying, does raise the cost up to probably to develop a really well-designed system that does more than just one little thing. I would say you could do it for under $1 million still from the design phase. Often the design piece, if you can get out to the field quickly and start learning and failing forward, can go really fast. And it's, you have these pauses. So I was explaining earlier, like one of the tactics we used was we would go rapidly build something, get it to a point where it's actually kind of working, and then let it go for a little bit, and then come back and do another really intense, qualitative, rich, on the ground type of building phase to kind of take it from its sort of nascent state to something that's actually useful. So one of the largest of these in the world, MTrack, which is a system that UNICEF developed in Uganda, has 27,000 health workers registered. They use it on a weekly basis for a lot of different things: health information reporting, disease surveillance outbreak. They caught Ebola with it and shut it down. While we were, I haven't slept in 6 months. I'm working on Ebola, while we were all focused on West Africa, there was an outbreak of the Marburg virus, which is a very similar hemorrhagic virus in Uganda. And none of you probably heard about it because there were 1,500 text messages in the first 24 hours, and the government actually had a response mechanism to take advantage of those text messages. They got out there and they got it. So that system cost UNICEF, in reality, they'll argue about this, but we got their budgets because we were curious, about $12 million over 4 years. And it's a national system, and it's heavily, heavily, heavily used and transformed the way that healthcare works in Uganda. 40 million people in Uganda.
Yeah, so I agree. This has been super, super interesting. So I was just wondering, for our particular context, right? If you look at the personas that use our different sites, that spectrum is really wide, right? And so
literally everybody.
Literally everybody. So I know in a lot of the examples you gave, you were working with a subset who had maybe more similarities when you were talking about like their technical capacity was very low. And so it makes sense today that there are maybe two separate solutions for, these different sub-segments. But do you think, looking in the future, as the technical capacity of all of them grows, is there a way that you think that it converges? Or are the two ends of that spectrum just kind of so far apart?
When the singularity happens, the entire world's going to transfer. No. I don't get to be in San Francisco very often. So I think a lot of it depends on time scale. I'm not good at predicting the future. If you had asked me when we started this work, when we were working actually back when we were working with MediaWiki, the phone thing was already happening. We were seeing it around us, but we couldn't see the opportunity space, right? We couldn't imagine these sorts of systems at that point. So I'm not good at predicting the future because I was there while it was happening, and it took us a few years to stumble across where the opportunity space was. But I don't believe we're going to get to some sort of global homogeneous kind of like information consumption level anytime soon. So if you look at what the World Bank's saying about eradicating extreme poverty by 2030, right? The economists were, I don't know, I have a lot of questions for economists, and they're kind of like, look at this graph, and like if you take China out of that graph and you take that middle quintile of people that are actually like pretty well educated and pulling off and pull them out of poverty, like if you remove that aspect, that last bit is so much harder to reach. So while I live and breathe this work, and I think we're doing some amazing stuff and we're accelerating things, I'm not sure by 2030 we're going to eradicate extreme poverty. I'm not sure that's even a possible thing to do. So I think there's always going to be a lot of market segmentation. And I think the other thing is, right, like probably in your own research with your own audiences, like how people in Japan engage with Wikipedia might be very different from how people in the Bay Area. Someone in Ohio might use it very different than how they do it in New York City, right? Like there's probably going to be a lot of segmentation even in that sense in terms of what's culturally relevant. Well, how do people imagine information and apply it in their day-to-day lives? So I think there's always going to be a higher level of nuance. I think in your case, there's segments of the population probably that use the services that you have right now, no problem, right? That you can just kind of write off. So like the upper class, right? If they need information, they pull up their iPhone 6 out of their pocket in Cairo and they like pump it in and boom, out they get their page, right? And they read it and they go off for the day. And then there's a group that probably is not going to be using anything like this for a really long time. But there's a whole middle segment that I think that really could be targeted and gone after, and trying to understand how do you empower that group to participate, not just consume, is a real opportunity space for you guys.
Yeah, thanks again, Merrick. That was a great presentation. I think my question is about like that technological wave that you mentioned, like 1998 to 2011, mobile phones. It's like nothing we've ever seen. Do you think that sort of the next generation of sort of dumb smartphones will have similar penetration, and will it allow us to do different things?
It's a great question. That's a many billion-dollar question, and there's some pretty, in my little world, there's a group of us that are arguing about this particular question all the time. So what we are seeing, I'll talk about a couple trends, and then I'll talk about a little from an anecdotal perspective. So smartphones are getting cheaper fast. Right? Like I believe that trend's accurate, that smartphones are going to get cheaper and cheaper and cheaper and cheaper. And all of those phones you saw were secondhand, right? So like the community health worker didn't go out and buy a shiny new Nokia. In fact, they probably bought a secondhand knockoff Nokia, and they knew what type of knockoff, right? They knew how good of a knockoff it was, and everyone's hyper aware of the quality of the phone the next person has, right? If it's a Techno with a pseudo smartphone technology on it, they're super aware, wow, that person's fancy and important. So smartphones are getting cheaper. I believe they will reach a price point and then proliferate into the secondhand markets, and people will actually have access to them. Number two, and we do a lot of this work, we're trying to figure out how to spur and continue the growth of 3G, LTE, and whatever is coming next, TV-wise space networks. That has slowed down. So telcos are really weird corporations. I wish I understood them. I've spent way too much of my life in their offices arguing about how to get better deals. I hate it. I never want to do it again, but I'm going to. It's just really hard. And I want to build cool stuff. So with that, they've stopped the accelerated growth of the data networks has slowed down. And so we're trying to figure out how to speed that up again. And how to get the data services out there. So the phones will be out there. Whether or not people will be able to connect to something is not clear. Now, completely different pivot, and I'll address this a different way. If you look at the two drivers that I mentioned in the beginning, and again, this is just me, lots of people have theories, but if it was the financial model of pay by the teeny chunk, and if it was competition with transport, that were two of the major drivers of adoption, the question I don't see an answer for, and I don't have a clear sense of, is what is the higher information or the app ecosystem competing with in people's day-to-day lives that actually improves their lives. So they might have a smartphone for a status reason, or they might have a smartphone just because there are only smartphones in the future. And those smartphones might be capable of a lot of things. Again, I can't see the future. I have not yet seen evidence of the and Gurmeet tried this with netbooks for years. And Gurmeet's done a lot of amazing work in Uganda in their app lab of how to get smartphone applications that are relevant to community extension, agricultural extension workers, and they sell microinsurance, and they do market research. They do they've figured out a lot of stuff on this. But that's an empowered class, right? That's a subclass. That's like the community health workers. It's a niche that figured out how to leverage the power of the smartphone. My gut. So my techno-utopiast brain says, well, of course, right? Like there's lots of unknown things that are going to happen, and when the technology spreads, so like there's going to be new opportunities, and out of that there will be new paradigms, right? But from the pragmatic where I'm standing right now perspective, I don't see it. Right? I don't see the telcos making the investments they need to make into getting the data where it needs to go, and I don't see the use cases at the user level quite yet. But I've got a beer in Dar es Salaam in 4 more years with a colleague from the World Bank. We made a bet, and one of us is going to buy the other a beer to talk about whether or not the smartphone actually did spread and get used. So if you want to get in on that pool, the going's good. Question?
Oh, well, I'm there.
Oh.
Related to the smartphone and dumb phone question, I'm curious about battery life and how that affects the adoption, and if it matters so much.
Yeah, oh yeah. I mean, so that Nokia 1100, that thing, I mean, the joke, I mean, a lot of you probably seen the meme jokes about it. Like, you kick it, you drop it in the toilet, you run over it with the car, and it keeps working. Like, it does. It's got a flashlight. That battery, people will turn it off, right? Which makes that battery that would last a week last a month, right? Like, and the dude who drives the motorcycle with the car batteries that charges it once a month comes by once a month, right? And they know that, right? They know the next time they can charge their phone, they don't need any fixed line electricity, right? And like maybe other places they have it at the markets, they can walk there and they plug their phone in and they go buy all their stuff and they come back and pick up their phone. Battery life matters a tremendous amount. And as we know, smartphones love to eat your battery up. So this is another question of, even if you do have the phone and you did have the network and you did have the use case, how many hours a day would you be able to use that? So a lot of the early experiments with Androids crashed and burned because the batteries just ran out halfway through the day. But cheap solar power. I mean, like there are those solar panels are literally everywhere. You can buy. There's like a stack of tomatoes, a stack of potatoes. Then there's like a whole bunch of really beat up ancient phones, probably from here. And then there's some solar panels like at sale in the market. So like cheap solar panel technology has proliferated, so there might be a complete, like, it doesn't really matter the battery doesn't charge because you're kind of used to it and you just keep it plugged in all the time. So battery life really does matter, and improvements in that will transform things, but people are pretty creative. If it's useful, they'll probably find a way to make it work.
So related to that question, early on you mentioned One Laptop per Child, which is a program that has its flaws, but I'm a little bit intrigued with. One of the things they did that completely fascinates me that I haven't seen many examples of is in an attempt to solve people's problems locally and not make assumptions based on our experience of technology. The laptops weren't like Dells off the shelf that they handed to kids. They sat there and they designed this thing for the user. It's rugged. It has a waterproof keyboard. They took a processor hit for the screen. All these sorts of things that are designed for the end user in mind. Still, when I see people like your work and other groups that come in, and they show photos of people using things, they're using hardware that's designed for us 15 years ago, not for them. Have you seen any advancements in the world of hardware that's actually designed with these users in mind? Because so far I've seen about zero.
So first, an anecdote that I think kind of sums up the problem. Microsoft Research in India, which is awesome, did this amazing project where they were going to make a phone for an illiterate person. And they did all of the right user research, and they made a completely useful phone for a non-literate person. The biggest problem was anyone using that phone was branded as non-literate, right? The fact that you had that phone in your hand meant that you couldn't read. And if you go back to that social awareness of people's phones, and that is a status symbol, which we've also done an ethnography on, that mattered. No one would touch those phones. No one would touch those phones. So there's an aspect of designing for them is not always like a mentality that works. Like designing with them might not even work. You really have to understand, like, what are the actual incentives and drivers of technology adoption in these contexts. The flip side of that is, yes, there's been Invenio, who's here, they're based at Mission Social. I think they run that collective there. They are constantly innovating the ruggedized hardware space. They've got the next generation of Rapid Pi, which I think ARM says is going to be like 8-core. Like it's really powerful. It draws almost no power. They're building the metal casings for it that are waterproof, and they're like going out and building like little server clusters with multiple terminals for kids to use in schools. There's a lot of innovation. Way. I mean, the OLPC. I believed in that project, right? And it didn't work. And it didn't work for a million reasons, and I'm so glad we did it, right? I'm like so glad that we all threw our energy against that because it taught us so much. Invenio? So they're a startup, not a startup, they're an NGO, startup-y NGO. Like all the people who run it also have startups. And they really came out of the ICT4D 1.0, the hardware group. And they're really cool. And there's a whole bunch of groups like them out there. But they're doing cool stuff, and there's a ton of it. And UNICEF has a lab in Kampala full of engineers that are tearing apart Intel classmate PCs, like just tearing them apart, lowering the power consumption by a lot, and again building multiple terminals that run off the same processor. So that pattern seems to be consistent in different markets and different places.
Thank you for your presentation. You talked earlier about needing to grow the developer pool for these projects because they were not necessarily technologies that they were well versed in, and how the training worked well, how the iterative cycle works well. I'm curious about what happened after you were done. How did they sustain those developer communities? How do they onboard developers? Is it similar to meetups, trainings, etc., or is it different in these local areas to build up those development communities, especially on the open source side of things, and how you focus that community?
You're gonna hate this answer. It really varies per country. It varies per country and it varies per culture. So in Nigeria, my friend Tim, who we trained up, we found him on NijaPulse, which was a Twitter ripoff, or not ripoff, but it was like they created a local Twitter called NijaPulse. We found him on there, we brought him in, we trained him up. That dude has created a company, he figured out international procurement, he's now working all over Africa, he's got a lot of devs working for them, all open source, all using that RapidSMS platform. He's designed Zambia's national election system. He is amazing. Like he is amazing, right? Those two devs I showed you there, they live in Zambia, and they are still, well, actually one of them got a green card in the lottery, but his replacement and him are still there at UNICEF, keeping the system up, alive, and running. They bought cars. They like moved up, and they bought, they pay for their family's schooling. Like they're earning a really good wage, I think between $7,000 and $12,000 a year, and this is like really good money. And they're like, I met their parents. Their parents were so happy that we trained them and brought them in, and like. They would never in a million years comment on the Google group that we had for the RapidSMS mailing list. And now they are crazy on that thing. If you write a question, it's probably going to be one of those guys responding. They are like such committed contributors to that community. Right, so, but it didn't proliferate, right? So like they didn't then create like the collective in Lusaka. Now there are a bunch. There's Bongo Hive. There's a whole bunch of like vibrant little pseudo collectives, but you're not seeing that sort of critical mass and that critical gravity, right? Even in Nairobi, which has 50,000 tech hub co-working blah blah blahs, right? Like there's a different focus to it. You're not feeling that sort of FOSS energy. I think that's a problem that we can actually like work on changing and addressing, because if you look at how those guys use the mailing list and how active they are and how much they care about that project, right? Like they get it, right? They really get it. They understand like what that tool does for them and their communities and how they contribute and why that matters. It's a hard problem.
Hello. Okay. So you mentioned rapid prototyping out in the field, and I know you can do rapid iterative testing, like you're doing usability testing with a group of people who are your end users. You also mentioned like getting it out there, releasing it, and see what happened. And I would like you to talk a little bit about your experience of those two types of iterating and how you might use them in combination, or.
Yeah, we did use them in combination. Like we didn't do one or the other. We did both. So the first rounds were like these super us there doing it type of rounds. But we had failed so much early on, we knew kind of the pattern. So with the launch of any sort of one of these technology platforms, there's this huge uptake, and we call it the honeymoon period, and it lasts about 3 months. And then you have this massive drop off in use, no matter what the platform is. And so we would kind of know this, and we time our development cycles kind of around where those drop offs were. And when we would explore like why like what was going on there. We kind of knew it was going to come, and it was for different reasons at different times. And so the letting it run for a while, it was to address the Hawthorne effect. Like while we were there engaging with people, we were disrupting the system tremendously. And to get these systems to scale, they have to work without you around. So like the problem with, for those of you, I don't know if this is a thing in your guys' space, but randomized control trials is the amount of presence you have to collect rigorous clinical data in these settings. Like changes the processes and management responsibilities and levels of accountability in these rural settings, and it's not an accurate picture of what happens when you're not there. So we knew that we had to both be able to like get it to a point where it was usable and then let it go for a while and kind of see what happens when we're not around. What happens when there's no one telling them to use the system? And we had to do that in a cyclical way. And then as we scaled, we also had to keep that in mind too. And what we find is, unfortunately, so we used graceful degradation, the concept from back in the day on the web, where you're like trying to design your site to not break if someone turns off JavaScript. It still kind of work, but like the core feature, the one thing that matters in your site, don't break that one thing, and the rest of it can break. But we use that here too. So like the core thing we were trying to solve, we would make sure it would work no matter what. And then the more advanced features often kind of got dropped after we left. So like the ability to relook up a woman's HIV results with a quick code off of the piece of paper, people forgot that they could do that or just didn't do that, or like so any of the more sort of advanced features kind of generally got dropped. It got dropped out of the trainings, but those core features really worked. And so we kind of designed in such a way that what is the one thing that cannot fail, and how do we drill that into people's heads, and then let's do some more advanced stuff on the sides for power users. Questions? Okay.
I just recognize Merrick has to get going. So thank you so much for coming in. Everyone, you've got his email address. I'm sure people can send you questions if that's necessary.
Yeah, it might be a little late.
Okay, cool. Well, thank you guys so much for coming and attending. Really appreciate it and all the really great questions. Thanks, Merrick.